Hello, everybody. Happy Saturday. I hope you guys are having a really good afternoon. If you're in the East Coast, if you're elsewhere, I hope you're having a good morning. I wanted to come on today and to give you a little bit of a recap of Pull Up with Limbs and Things, give you an opportunity to ask questions of me as a physical therapist, and to help you to improve your movement. So with Pull Up with Limbs and Things, the goal overall was to provide education, right? To make it so that you are either confirming something you know, to be able to challenge something that you don't know or something that you're currently doing, and to perhaps help you to share with someone else ways that they can improve their health as well. So physical therapy, in my view, is a holistic approach to it. You want to make sure that your mind, your body, and all that incorporates who you are is well and healthy. So Pull Up with Limbs and Things, we first started with Marnie. She is a consultant with Arbonne, and she was talking to us about the importance of making sure that we are remaining healthy with the things that we eat. And what I remember most from that is to make sure that you either eliminate deli meat, or that you are making sure that you don't have it as much as you would before. And then when we had Dr. Terrence Pleasant, he was talking about ear, nose, and throat issues. And every time now that I go and get a Q-tip, I often think, okay, maybe I shouldn't put the Q-tip deep down as far as I would to try to get wax out of my ears. All of those things that necessarily we don't always do, but we're just so accustomed to doing things the way that we've always been taught that we can find another alternative to doing it. And then with Dr. Harrison Beasley, he brought to us information from his background in pharmacy and telling us that if you have your medications at one pharmacy and then you go to another one, you can't necessarily ensure, or they can't as your pharmacist, ensure that there's not that drug-to-drug interaction, because only those that are listed in that particular pharmacy, they're able to cross-reference. And then with T. Rhonda Lockhart, the cardiac nurse, she was telling us the importance of your vital signs and knowing your normal values and making sure that your blood pressure and your heart rate, all of those things incorporated with healthy eating and exercise, are the ways to reduce your risk of having any heart issues. And then we talked to Synergy, prosthetics and orthotic companies, just last week, week before last rather, and we were talking about how with limb loss, you can have diabetes and traumatic events that can cause those things, but that's not the end for you. You can have a prosthetic to improve your ability to move. You can get any level of prosthetic. So if it's your ankle, if it's below the knee or above the knee amputation, they can help you with that as well. And then last week we talked to Age-Wise with Miss Florence, and she was telling us about all the ways that you can modify your home so that you are able to remain in it and age in place. It's so important that we consider all of the ways that you can adapt your home, especially living in what we find mostly up here, 3-level homes or homes that have stairs. As you get older, those things might be a little bit difficult for you to do on a regular basis. So stair lifts, we also talked about having smart devices so that you don't have to always get up to answer the door, especially if you're unable. Someone is still able to come in and help you. So she talked about smart locks that can be used as well. So that's just a recap of all of the things that we've done with Pull Up with Limbs and Things thus far. Today is an opportunity for you to ask questions and to have your question answered if it's movement related. So if you have any, I'm gonna give you a little bit of opportunity to ask them. You can put them in the chat and I'll respond to you. I'll give you a little moment. Hello, if you're just joining. Hope you guys are having a good day. So let me tell you a little bit about Limbs and Things while we're waiting for your questions. I started Limbs and Things after I had been doing a skilled nursing facility in the area. And I was a contract therapist just before starting Limbs and Things. And just before I had a daughter, and going back into the skilled nursing facility was a bit off-putting to me just because the COVID cases there were a bit high, and I wanted to ensure the safety of my family. And so I decided to branch out into LimbsNThings. However, the legalities and the business side of it was already done back in 2018, but actually taking the plunge to do it completely started last year in May. Let's see, we do have a question. Why does everybody only use insurance for physical therapy? I think a lot of why insurance, not just for physical therapy, but for all healthcare services, is just because we are accustomed to things that are what we've always done. And so with insurance, it does give you an opportunity to get in at a reduced rate. There are insurance companies that contract specifically with physical therapists. Like with LimbsNThings, I'm contracted with Medicare and with TRICARE. So that doesn't mean like I get all of those patients, but it does mean that people who have that insurance are able to come in and not have to pay an out-of-pocket cost, usually. With insurance, there are a lot of restrictions, and that's the point that the healthcare professionals, us as physical therapists, as any other medical professional, we have some restrictions in what we're able to do when you use your insurance. And so a lot of what you've heard and pull up with LimbsNThings may have been not necessarily positive about insurance, just because we know that there are things that we want to see patients achieve, but that insurance kind of prevents us from going the full way that we want to. So I hope that answers your question. If there's anybody else that has one, feel free. I'll give you a few more moments. So this question, I have Kaiser Permanente, but I want my own physical therapist. How am I able to select my own therapist? So with Kaiser is very selective. They only allow people who have Kaiser to go to Kaiser therapists. They do not allow you to select your own from that perspective. So if you have Kaiser, you have to go to a physical therapist that affiliates with Kaiser or that is already in their network. If you want your own physical therapist, however, you don't have to use your insurance. You can be a cash pay client where you pay out of pocket. You probably have to sign a waiver that you're not going to use your insurance, just so that we all know and understand that Kaiser won't necessarily cover your services, but you can have a cash-based therapist if you want to do your own therapist outside of insurance. So, hope that answers that question. I had a few questions come in, and one of them was about how you are able to maintain or decrease swelling when you have swelling all the time. And what was interesting is the fact that the person says that they elevate their legs all the time. However, but in doing so, they elevate with their shoes on. So it's so important. And we always think, I think as a physical therapist, that the person is going to do it exactly how you're thinking of it in your mind, and that may not be. So if you are having an issue with swelling, or what we call edema, and it's in your lower limbs, you want to make sure that you're elevating above the level of their heart. So if you're laying flat, that your feet are all the way up, so that that fluid that's in your feet is actually draining into your lymphatic system. And the best way to do that is to lay flat, not having your head elevated, have your feet all the way propped up, and allow that drainage to come into your groin area. You'll know that the swelling is going down if you have to go to the bathroom. So it's so important that you are actually making sure that your shoes are off, your socks are off. That also helps you to reduce that swelling and not have any restriction of the sock, like around the leg, or the shoe surrounding the ankle. Okay. How far do you service, and do you cover all of the DMV? Okay, so with LimbsNThings, I serve all of DC, I serve PG County and Montgomery counties in Maryland, and Fairfax County, Arlington, and Alexandria in Virginia. So Northern Virginia, PG and Montgomery counties in Maryland, and all of DC, all quadrants of DC. With home health, the reason that I only serve those areas is because I used to be a home health therapist where I was going from the borders of West Virginia to all the way to Arlington. That is a very large stretch of Virginia, and that was just too much. I wasn't able to see enough patients in a day. To me, I was actually working for another company at that time. However, that amount of time was spent mostly driving, and then with every time a therapist is seeing someone, you have to document. And so documentation time was cut short. I was having to do that at home because you're not able to do all of it while you're with the person. And for me, it was more important that I give you all of my face time when I'm with you, as opposed to being in front of you and actually typing on a computer. So that was too much of a distance. So I wanted to make sure with LimbsNThings, I tailored it to an area that was feasible for me to manage. And I don't see people in all of those quadrants every day. So I've broken up the days so that it makes it so that we're able to see more people. And telehealth has made that even better. You can see even more people in a day. So, hi, Miss Irvin. So if there is anybody else that has a question, feel free to ask them. Hi, Miss Cynthia, how are you? I can't see everybody that's on, so if I missed you, I apologize. If you have a question though, feel free to ask me. I'll stay on for a little while longer. There was another question that came in that was talking about how you work to being able to go up and down the stairs. So there's a patient that I have had recently where she thought she was just going to go up all of the steps at one time. We were initially starting it, so we worked to being able to increase her endurance on level ground. And then we were working on the stairs because she wants to be able to go up to her bedroom that's on a higher level. And so a lot of times we think, okay, it's just steps, I can do it. But you have to consider how your steps are laid out in your house, if there's a railing there, what assistive device you have. There's so many factors that go into being able to do a particular function. So in doing so, we had to gradually work on that first step. And everybody's steps are not up to code. Did you know that an average step is supposed to be 7 inches? There are some homes that's not the case. And so being able to go up those steps with the assistive device and teaching you the mechanics of doing that, it all depends on how your house is set up. So there's not necessarily a way to answer that specifically unless there's more information provided. Okay, let's see. My ankle leans to the side when I walk. It hurts all the time. What can physical therapy do to help? So it all depends on how it happened. And then how your ankle is positioned now, if there's more leaning to the inside, like to the other foot, or if it's more leaning to the outside, and then how you are actually bearing weight on that ankle as you're walking. So yes, physical therapy can help with either getting alignment of your ankle, improving your balance, making sure that there is proper alignment if we use like an orthotic device to help you. But the alignment is key in making sure that the issue doesn't continue to happen. So getting to the root of the problem of why the ankle leans to the side is what physical therapy can do primarily to help you. Okay, there's another one. Are there any signs to tell when physical therapy is needed versus pain from older age? Okay, I think I understand your question, but feel free to add anything else if I don't necessarily get everything you're trying to tell me. So you do need physical therapy if you're finding that as you're getting older, you're falling, or as you are doing your normal routine, you just cannot do the things the same way you were doing before. So that just says that your function is declining. A good way to think about if you need a physical therapist is, can I do what I was doing before now? And age doesn't necessarily have to play a factor, but it should be function before it's age. And tell me what you mean about pain from older age. I'll wait for your answer. So, just in general, signs to tell when you need a physical therapist is if your function is declining. Of course, it could be if you are having surgery, post-surgical. That's a need for having physical therapy to rehabilitate yourself to get back to what you were doing before. And then if you have a limb loss, if you have any cardiac issues, say if you're post-COVID, right, and you're having difficulty maintaining your breath as you're doing your normal routine, physical therapists can help you improve your endurance as you build up your aerobic capacity again. So Shamia, let me know if that answers your question. Oh, I think I do get pain from older age. Is it PT that's needed, or is this just happening because you're older? I think the main thing is if you're getting older and you're getting more sedentary, you're sitting more, you're not doing what you were doing before. Say you were an active person always going to work and coming back home, but you actually did something else in between. You were constantly on your feet and now you are not as active. Then you need to consider activity more than physical therapy and trying to increase your function that way to build it back up. And that could really eliminate the pain from happening, just if you're more active. Okay, let me see what you're saying. If my hip starts hurting when I do certain activities, should I consider a PT? Sounds like no, unless it impedes on daily function. So, for what you just said, yes, I would, because you want to know why it's hurting when you're doing certain activities. In a direction that is hurting, when it's hurting, like if you're loading the hip or if you're sitting down, all of those things a physical therapist can help you to determine. A lot of people refer to us as movement experts, and so knowing how this is happening or how your hip is starting to hurt is a reason to see a physical therapist, because that sounds movement related more than pain that is caused from a different situation. I'm gonna go back to one question and I'm gonna get you the next one. What's the difference between physical, occupational, and recreational therapy? Okay, so physical therapy is, we deal with 5 different areas of your body. So your skin, the integumentary system. So if you have post-surgical, if you have an amputation, even if you have a regular wound, we know the wound healing process of the body or the skin, and we can help you to know if your wound is healing properly and to help you with, say, a wound vac if it's needed that the skin needs to come together. I used to work in a trauma ICU unit, and I had a gentleman who, it might be gruesome what I'm about to say, but his core was open. He was in a motor vehicle accident where he slid on the ground and it burst his abdomen. And so we had to use a wound vac to close it up. And so that's a way that physical therapy can do it. There are some physical therapists that only do wound care. The other areas are neuromuscular, and that's more like your strokes, your issues with multiple sclerosis, muscular dystrophy, cerebral palsy. If you have anything that's neuro-based, those things would be more physical therapy in that aspect. Spinal cord injuries are included in that as well. If it's musculoskeletal, so like your hip pain that you were talking about before, if you have a surgery and a hip replacement or knee replacement, all those things are considered musculoskeletal. And then for, so we did integumentary, musculoskeletal, neuromuscular, cardiovascular, and cardiopulmonary. Cardiovascular is more with making sure that you're able to have good circulation through your body, and I see another question about that. The lymphatic drainage, all of those things. There are therapists that only do lymphatic drainage or lymph. And so we want to make sure you know that as well. And then cardiopulmonary, if you've had a a heart attack, that would be cardiovascular, but cardiopulmonary. So anyone who has pneumonia, or if you have a chronic case of issues that are affecting your ability to breathe, you get a new oxygen machine, anything like that, those things a physical therapist can help you with as well. We are cardiac rehab. We work in those settings as well. And then with occupational therapy, I think we talked about this a while ago in one of these segments, where occupational therapy is more geared toward helping you return back to being able to be at home with putting on your clothes, doing your what we call activities of daily living, so brushing your teeth, combing your hair, making sure that you're able to go to the bathroom and be able to manage all of that as independently as possible. And then also preparing someone, if they are going back into a work setting, to be able to safely do that. If you're going back home, making sure that you're safe to be in your home. So doing like a home assessment, like we talked about last week. And then recreational therapy. Recreational therapy is more about having someone that has had all of the things that we talked about, getting back to doing something they actually love to do, but haven't found a way to do it with their new situation. So with, say, someone who has a spinal cord injury and they want to go back to being able to canoe or to drive or to do any of those things, a recreational therapist would help them to be able to do those things. In my practice, I use elements of physical and recreational therapy to make activities fun, but also functional. So, Miss Cynthia, you said, could you wear your circulating socks with your legs elevated? Yes. They give even a better compression for being able to push that drainage out. So, I actually had a patient recently this week that was talking about not wearing his socks because they are too tight. But when you do a combination of what we call RICE, so rest, ice, compression, and elevation, that's the best recipe to getting that swelling down fast. So I hope that answered your question. I know that was a lot of talking. So if anybody else has a question, I'll be ready to answer. Yes, Miss Irving, it is not about age. So don't think that as you age, I'm just gonna hurt. That's not true. All right, it's function based, and it's how we take care of our bodies. There are so many people that are aging. I currently have, my oldest patient is 92, and my youngest is 34. And though they have completely different scenarios, my 92-year-old is able to do a lot more than you would think. He is not frail. And I'm teaching him how to maintain his balance and to be able to get back into his church whenever churches open up again here, with just using his cane. He wants to make sure that he is able to do that, speak to everybody that he wants to speak to, and go from his car to the door without having to worry about, is he going to fall? So that is the goal, to make sure that you, as you age, you're still functional. So I'll wait for your questions. Miss Cynthia, I hope that answered yours. Let me see if there was another one that came in. I'm seeing if you guys have any. Okay. There was a question that came about what's the importance of breathing as you exercise. So there's something called Valsalva maneuver, and it's a lot of times that we tend to hold our breath when we're exercising, and I think it's just we're wanting to make sure we do a good job and we don't want to mess up, and so we tend to hold our breath. But if you don't breathe, it will negatively affect you on the inside. It just increases that internal pressure on the inside of your body, and that's an unnecessary stress to your heart and your lungs, and so we definitely don't want that to happen. When you breathe, you'll actually find, like, if you were to lift both arms and you take a deep breath and then you let it out, you're able to lift even further. So breathing has its importance, just as if you guys are into yoga, the importance of breathing helps you to be able to stretch a little bit further. It's the same principle with exercise, why breathing is so important. Let's see, is there any specific preventative information you can give to help with making sure you're caring for your bodies on a regular? Yes. So I think the most important thing is being active, getting up on a regular basis, not just if you have something to do, but making that something that you are doing on a regular basis. So get up. If you are finding that within a 2-hour time frame you haven't gotten up, then that's too long. You need to get up very often. It increases the circulation in your body. It's beneficial to your posture, because when you're weight bearing, you improve your bone health. And as we age, osteoporosis is more prevalent. Not to say you would get it, but it's just so important that you are getting up and that you are also working on your balance. One thing that I try to do is, as I'm brushing my teeth, I'll stand on my tiptoes and I'll come back down. That's just a way to get exercise in, but it also helps me challenge my balance. I'll stand on one foot. There are times when I'll just start walking backwards just to improve my balance. So it's so important that you challenge yourself as you're aging, because you don't want to lose any other function you currently have. So make sure that you're moving, and make sure that you are maintaining your balance, challenging your balance. But also another good thing is to make sure that as you are aging, you don't use things that are actually going to end up hindering you. I find that so many people have these recliners that helps them to stand up. And why would you do that if you can continue to make the ability for you to stand up? You don't want to lose it. So I can see a recliner being used to elevate your legs, but I wouldn't use it if it's just to help you to stand up. You need to really work on doing that as much as you can independently. So, oh, you're welcome. I'm glad that you're finding it helpful. Well, I hope you will not fall, Shamia. And yes, you can always call me. Hello, Mr. Saunders. Recommendations on managing knee tendon pains. Yes. So a lot of times we tend to just load automatically. I was just talking to somebody the other day that had the same question, and she finds it difficult to actually squat and bear any weight on that leg and bend down to like retrieve something from the floor. So a good thing to do is to hold your leg out straight, and then if you are able to maintain that for 30 seconds, you're strengthening your quad muscle, which goes right over top of your knee. And if you just are able to hold it, that's almost the same as being able to load it with standing or anything that's weight bearing. So the best thing you can do right now, especially if it's painful, that knee tendon pain, is to painful when you bear weight, is to make sure that you're holding that leg straight out and being able to hold it for 30 seconds. You can do multiple repetitions of it, whatever is comfortable for you, but you definitely want to make sure that you're not doing loading activities that could increase the pain. Now, walking has to happen, but if it's that you're reaching and bending, then I would just recommend that you do the non-weight bearing type strengthening exercises for that knee tendon issue. But you let me know if you have any more questions or you want a further response to that. Thank you guys for watching. If there's anyone else that has a question, please feel free to ask. There's so many times that healthcare professionals want to have your questions, but we don't have a platform to ask them. So if you have a question, please ask. Oh, you're welcome, Mr. Saunders. No problem. So the other comment that came up too is being able to stand and sit, or a way that you're able to determine how you're doing functionally. There's a functional assessment almost for everything in physical therapy. And one of the ways you can tell how well you're doing, especially if standing up and sitting down is difficult, is to stand up from your chair 5 times and making sure that you're able to do it in less times each time that you're doing it. That shows the strength of your quad muscles. It shows your balance and being able to stand and sit. And it also keeps you limber. Oh, the other thing, Shamia, I just thought about it, that would be good for preventative things is staying flexible. As we age, we tend to stay in a particular area for a considerable amount of time, and we don't even know it. But if you're sitting more, then you don't have as much flexibility of your body. And so you want to make sure that every morning when you get up, you stretch, right? You're lifting your arms, you're moving them side to side, you're able to move your torso, you're able to reach as far down as possible for you. You want to do diagonal movements as well as straight up and straight down, because we don't move like that all the time. It's so important that we stay flexible, we maintain our balance, and we also bear weight on our bodies so that they can accept them. And as we age, sometimes our weight changes, and your body has to adjust with that as well. It can affect your balance, and that can cause you to fall. So you want to make sure that you're doing all that you can as we get older to maintain our bodies and prevent things from happening to us. So physical therapy is rehabilitative, preventive, and maintenance-wise too. Yep. So, any other questions? Feel free to ask. Let's see if any other questions came in that I might have missed. Yeah, so yoga, tai chi, just regular stretching. You don't necessarily have to do anything formal. All of those things are beneficial to increasing your flexibility. The more a joint, a muscle, all of those things are able to move, the less pain you will feel, and the better overall you will feel, because they release endorphins as well that help with your mood. So with physical therapy, we try to take a holistic approach at LimbsNThings, because everything that comes with you affects your ability to function. So if you're in a different mindset when therapy is happening, there's an opportunity for you to vent, say whatever you need to say, so that you're able to move and work as fast and get to the goals that you have set for yourself, and that the goals that we work together to obtain. Let's see. I may have missed it, but what is the youngest age range you work with? So the youngest age range that I have currently is 34. But I just don't see pediatrics, and I tend to say aging adults mainly because I accept insurances that are mainly for the aging population. So if you have TRICARE, if you have Medicare, then there is easier. Medicare Part B is what I accept. Then it's easier for you to get in. However, if you're cash-based, I can see anybody from any age. I've worked with pediatrics to aging adults. So the youngest currently that I've seen, I think, was 6 months. And the oldest, as I mentioned before, is 92. So physical therapists can see the gamut, any age range. There are certain ones that we are more prone to seeing, or the ones that we see the most tend to be those in that Medicare, TRICARE age range. And because it's not necessarily a specific age that either one of those do, because I have some people that actually have been a beneficiary of Medicare Part B that are young. So it's not just if you are that 65 or older age. Is it safe to go to the gym? I can't say. It depends on where you live, right? And how safe you feel. I think that is a personal decision, and you have to make that independently. All right, let's see. What is the reason the 6-month-old was referred? There are sometimes as kids age and develop that they are not developing in what we call the typical manner and typical development. So there are cases like torticollis where your neck is like in this position here and there's difficulty in turning your head. There are issues where there is a lot of leaning on one side, and so shape of the head, or what we call hydrocephalus. Those types of things are mainly what's seen in that age range that I've seen. Has the Rice method changed any? From what we talked about earlier, because I mentioned it, with rest, ice, compression, and elevation, what I'll tell you is most important is that ice is completely surrounding the area. There are a lot of times where people just put ice on the top, and you want to make sure that the ice goes all the way around, because if it's not, then wherever the swelling is or the area you want to reduce it, it's just going to go to the other side. And so if you have ice that's going around the whole area, then it really hones in and decreases it faster and more symmetrically. The compression, you can use anything, so ace wraps, compression socks, those are most effective. And then elevating, I was saying that we should elevate it above the heart. It's called a position that helps you to have, this would be your head down here and your feet up here. And you just want to make sure that as it drains down, it's going into your lymphatic system so that you're able to know that you are getting as much of a reduction, because you'll have the urge to go to the restroom. You haven't. See? That's why we should talk about these things. Mr. Saunders was on it. He knew everything about the rice. Yeah, so the rice method is important, especially if you have an injury. It's most effective if an injury is recent. If it's a chronic issue, it can still be effective, but it may take a longer than just the one period of time of using it. Okay, I'm ready. Yeah. I hope this is helpful to you. If there's a question that is not being asked that you want to ask, please do so in asking it. There was another question. Oh, I can't think of what it was. Let me see. Oh, about the importance of staying hydrated while you're exercising. There are so many times that I'll just say, don't you think you should have a drink of water? Hydration is important for your skin. It's also important for your body. Our bodies make up, water is made up of a great majority of our body. And so if we don't have that to replace, you'll feel it most in your throat, especially if you're working out hard. And you just want to make sure that you are having your tissues be supplied by water, as well as when you're losing it, because you lose it through sweat, and then you want to replace it. Now, if you don't like water, Gatorade and Powerade will work. Putting something in the water to make it taste better to you that works as well. I have found that people who have like muscle spasms, or you are more prone to getting cramps in your muscles, Gatorade works fast. Powerade works fast too. They are the most effective in relieving those. So you can try it next time you have a Charlie horse or you have a muscle spasm. If you drink the Gatorade or the Powerade, it should reduce it. And you can stretch it out as well. That'll help even faster. I see we've had some more people join us. I can't see all of you, but thank you. Feel free to ask a question. I am a physical therapist. I earned my doctorate of physical therapy from Alabama State University. And if you have a question, I'll be sure to answer. And if there's something that I'm unable to answer, I'll definitely get back to you. Yes, it does. Miss Barbara, mustard works for muscle cramps too. You taught me that. What types of exercises do you recommend seniors do to keep their balance and reduce stiffness? So we talked about that a little bit. My favorite balance exercise is standing with my feet together and closing my eyes. There is a lot of importance that we place on vision for our balance. If you are able to close your eyes with your feet close together, you are able to channel more into your proprioceptive input, so your ability to know where you are in space. That is so important in terms of your balance control. So to reduce stiffness, moving a lot. So we were talking about, like, in a 2-hour time frame, if you're only standing one time, that's not enough, right? You want to be able to make sure that you are keeping yourself active, just like you would if you were doing something. Like, I know a lot of us are at home still, but going outside, making it an effort to check your mail, making it an effort to possibly go to your car or to go outside, to stand up and go to the bathroom, to reach for something, or putting things out of your reach so you actually have to walk toward them. Those are so practical ways that you can reduce stiffness by staying active. It's important to note that if you have stiffness, you're probably going to start having pain. The lack of movement begets pain, and pain begets staying in place, and then you get more pain. So you just want to make sure that you're staying as active as possible and being as flexible. That flexibility will come with more movement. There's a couple of comments here. I just want to make sure I didn't miss a question. Yeah, she's talking about mustard like on a hot dog. Yes, that is effective in reducing muscle spasms. She taught me that too. I didn't know that. I learned from my patients too. Yeah, let's see. No, definitely eating it. Yep, eating it. Okay. Any other questions? Thank you guys for joining. You eat it. Eat the mustard. Hi, Pat. Hi, Daddy. Hi, everybody else that's on here that I can't see. Let's see. She would have to tell you how much to eat. I'm not sure. Is repetition important for the exercises for seniors, or the frequency? That's always the $1,000,000 question, right? How often should you do something? It depends on the actual goal that you're trying to reach. So if it is strengthening, repetitions are better. If it is just you want to be, let's see, if you want to be flexible, if you want the balance aspect, the frequency is important. Okay. Repetition is more so for the strength. Frequency of doing it is the balance, the control, the endurance. That's how you want to look at it. What is your goal with doing whatever exercise it is? So if you need more upper body strength and you're doing repetitions of things that are like, say, lat pull downs, where you're pulling down on something and you're trying to increase your arm strength, yes, doing more and more repetitions of that will increase your arm strength. If you are having issues with your balance, or you're finding that standing up from a chair or going up and down the steps is difficult, then the more times you do it, the better you'll get at it, and that goal of what you're trying to achieve will be achieved. Shamir, you said mixing it with something. Mustard, it's just eating it straight. Nothing else is mixed in it. Oh, Mr. Saunders, yes, we definitely should connect online. Yeah, I'm definitely interested. So, yes, I will send you a message shortly. Catch up does not work the same way. Hi, Pat. Repetition for strength, frequency for endurance and control. Yes. Thank you for the synopsis. That is true. Yep. And Mr. Saunders, I'm actually doing a virtual meeting on Monday for a school in DC, or in Maryland, actually. So yes, that is definitely something I'm definitely interested in. Giving back and making sure that people know about physical therapy and about owning your own business is important to me, so that you know that it's possible for you. Okay. So I won't hold you. If there's anybody else that has a question, please feel free to ask. Do I think taking turmeric helps with seniors to reduce pain and edema? I think it does. There are definitely holistic options out there that are beneficial. Overall, I think it is a combination of doing some of the holistic aspects and the more functional things to help you to reduce the pain and the swelling as well. Yes, thank you for your comment on that, Mustard. It is so important that you share your gems. Yes. So if you're not getting relief, after 10 minutes, repeat a tablespoon of mustard for your muscle cramps. And it can be anywhere, not just in your big muscle groups, but also in your hands as well. Thank you so much, Mr. Saunders. All right, is there anybody else that has a question? Yes, bananas are helpful too, like muscle twitches, but mustard and bananas, are helpful for your muscle twitches. And Gatorade too, and Powerade. Those electrolytes have to be replaced when we deplete them. And the faster you deplete them, the more you need something quickly to bring them back up. I hope this has been helpful to you. If there is nothing else, I'll end this live. But I thank you for joining and asking all of your questions. I hope you found them to be helpful. And then you guys have even shared helpful information for those that are watching as well. And so that's so important that we all learn together and that we're able to help one another. Hope you have a great rest of your Saturday. Take care.